Now these lines I find better to treat at 90 degrees. This is the zygomatic muscles causing this. It's quite a lot of strength, stronger muscles in the face. So we're going to do 90 degrees first and then think about the next step. Head towards midline. And the pressure I put on the cannula like this is just to help curve it round so that as I'm pushing forwards, it's pushing into the hypodermis and not trying to scrape along the underside of the dermis. Just looking for weak points along the skin that I can use to target, which will create a bit more structure. There's a little one there, so I might do a little tweak. So it's normal as you sit up, the fat pad will shift slightly forward, and this is one of the key points of resistance. It's just anterior to the medial ligament. I sometimes call this like the Eiffel Tower technique, because we've built a tower of filler on top here. We just need a base for it. So I'll put a little bit, just a little bit on, and it's at the level of the periosteum, which is a stronger place to resist than if you're in the hypodermis. So And very important not to put too much there because it's obviously widening and it's not feminizing to the white jaw there. It's just the support. I can see it very well from the angle I'm at. There's a little kink inwards, little dip. That's what I'm trying to get rid of. I've talked a lot about what I can see now that we've done that and supporting the chin is there is actually a little bit of room for focusing the chin. So it's certainly not an augmentation, but just creating more of a heart shape at rest. If I can make the lower part here the more dominant. So just a little bolus here will just bring the chin slightly down. It's a very small amount in the scope of augmentations. It's not an augmentation, it's a focusing. Chin injection, midline, keep your hand parallel with what you want to produce. As I can see here, partly because she's anticipating an injection, there's a little bit of tension in rotating the chin up. This will actually help resist that. And we will keep that chin lower down, which is the heart shape we're after. So I'm going to put a little bit of support here to stop the chin rotating up. I'm checking I'm directly in the midline all the way down. We enter straight. Remember, a female chin, it is often the lower point. That's the lowest point on the face. It's not square, so that's why a midpoint entry is good. Aspirated, little bolus. And we can go a little each side. Sorry. Now that we've supported all the structures, we're going to do some more superficial work to treat the actual crease using Volbella. These are very superficial injections in order to unfold this crease. Now, a little test, I can see when I pull this apart, it doesn't disappear that easily, so it may not be a 90% gone, hopefully 50%. And then with time it might get better. However uncomfortable that was, it was worth it.